Hi guys, my name is Milan and I will be presenting beta blockers, specifically Metoprolol. Understanding beta blockers. So there's several different types of beta blockers, including selective and non-selective. We will specifically look at beta-1 selective adrenergic blocking agents like Metoprolol, also known as a trade-marketed name Lopressor. The main uses for beta blockers are for antihypertensive therapy, cardiac arrhythmias, heart failure, diabetes, coronary artery disease risk, post-MI, and angina pectoris. How do beta blockers work? So beta blockers allow for the heart to relax and beat more slowly, which reduces the amount of blood that the heart has to pump. The heart uses less force. It doesn't have to work as hard. And some examples are metoprolol, atenolol, propranolol, and carvedilol. As you know, a lot of beta blockers end with LOL, so you can kind of think that beta blockers are funny. So differences amongst beta blockers, there's first generation and second generation beta blockers, which are differentiated by which receptors are blocked. First generation are non-selective, so they affect the body systemically as a whole, and they block both beta-1 and beta-2 receptors. This results in reduced cardiac output and reduced renal output. Second generation includes metoprolol. It is selective and only blocks beta-1 receptors, which only affect the heart and reduces cardiac output. Metoprolol is a cardioselective receptor blocker. At high plasma concentration, it inhibits beta-2 adrenoreceptors, primarily found in the bronchial and vascular musculature. It is biotransferred in the liver and mostly excreted through the urine. It is well absorbed after oral administration and crosses the blood-brain barrier, also the placenta, and small amounts can enter breast milk. So it is important to consult a physician if you are pregnant when taking metoprolol. It is mostly metabolized by the liver, and the half-life is 3 to 7 hours. If you take it PO, the onset is within 15 minutes, and it lasts between 6 to 12 hours. The extended release form lasts over 24 hours, and the IV is immediate effect, and the duration is 5 to 8 hours. So some side effects of metoprolol include blurred vision, chest pain, discomfort, dizziness, faintness, shortness of breath, sweating. Some less common side effects are bloating, swelling of the face, hands, arms, legs, or feet, decreased urine output, cough, labored breathing, weight gain or loss, and a headache, and rare or clay-colored or light stools, difficulty moving, stiffness, muscle pain, and weakness. Most side effects subside after 2 weeks of taking the medication. The most frequent side effect is weakness, fatigue, and erectile dysfunction in men. Bradycardia, heart failure, and pulmonary edema can be life-threatening adverse reactions and must be notified by the healthcare provider immediately. Nitrate should also be avoided as it can cause severe decrease in blood pressure and lead to unstable hypotension. So some overdose symptoms also include bluish color of skin, palms and nails, change in or loss of consciousness, and stopping of the heart. Beta blockers should not be taken with alcohol. Well, a lot of medications should not be taken with alcohol, as it can lower the blood pressure and cause increased dizziness or drowsiness and result in changes in pulse or heart rate. Hypertension is a condition that can be treated with a beta blocker. It's obviously abnormal high blood pressure. We all probably know someone with hypertension. So it's determined by the amount of blood the heart pumps and the amount of resistance to blood flow in the arteries. Normal blood pressure ranges between 120 and 80s. In most cases, there are no symptoms of high blood pressure, so a lot of people are walking around and they have hypertension. According to the Center for Disease Control and Prevention, hypertension affects about 75 million American adults, and approximately only half of these actually have their disease under control with medications or exercise, weight loss. Nearly 1 out of 3 adults have prehypertension, and nationwide this affects about $46 billion per year on the average cost of hypertension, like treatment, medication, missed day work, and hospital visits. Heart failure. So heart failure is when the heart cannot pump enough blood to meet metabolic demands. The heart muscles are weakened and this develops slowly over time. This results in conditions like hypertension and CAD. Some symptoms are shortness of breath, coughing, wheezing, weight gain, edema, fatigue, or change in heart or pulse rate. So beta blockers improve outcomes in patients with heart failure. This inhibits negative effects associated with sympathetic nervous system action. Cardiac arrhythmias, change from normal sequence of electrical impulses. So the heart may pump too fast, too slow, or erratically, which causes arrhythmias. Different types are Brady, AFib, atachy, heart block, ventricular tachy. This is a little short video I'll show you.
A change in the heart's normal electrical conduction system can result in an arrhythmia or irregular heartbeat. An arrhythmia can be an abnormally slow heartbeat or an abnormally fast heartbeat. In some cases, it can be fatal.
So some therapeutic goals is to restore perfusion, reduce blood pressure, increase cardiac output, improve myocardial contractility, obviously lower heart rate. So we always monitor patients' blood pressure, heart rate, and observe for any signs of adverse reactions and document any of these findings. Some contraindications and precautions include metoprolol should not be taken with patients who have sinus Brady, heart block greater than 1st degree, cardiogenic shock, and overt cardiac failure. Hypersensitivity can include sick sinus syndrome and severe PAC. Risk are anaphylactic reactions, and that is, of course, with any medications you are taking the first time. Avoid abrupt withdrawal of beta blockers as it can precipitate a thyroid storm. So nursing considerations and patient education. You definitely want to monitor the blood pressure and heart rate and rhythm. Metoprolol should not be administered if the blood pressure systolically is less than 110 or the heart rate is less than 60 because it can cause hypotension or bradycardia. We want to monitor the labs like electrolytes, renal and hepatic function studies, especially because it's biotransferred in the liver and excreted of the urine. Obviously monitor for any side effects or adverse reactions. We always want to make sure the patient takes metoprolol with food to facilitate absorption. Just always contact your physician prior to abruptly discontinuing, as it should be tapered off when metoprolol is discontinued, and medication compliance is key. So cultural considerations, patient education is crucial. Always want to consider the patient and family's literacy level to which they comprehend. It is important that with the minor or the elderly, other family members are involved so they can understand what's going on with the patient. We want to use culturally sensitive materials and educate the patient and family depending on their certain values, beliefs, or cultures. And we also want to consider their language barriers. So if the patient does not speak the language like English, in our hospital we use blue phones or translator to make sure they interpret all the information correctly. So some drug-to-drug interactions include antidiabetic agents because they can cause hyperglycemia or hypoglycemia, nitrates, digoxin, verapamil, or clonidine, barbiturates, MAO inhibitors, steroids, theophylline, Selectic dopamine, NSAIDs, and contrast agents. There is a risk for bradycardia when you combine with medications that also affect the heart rate, like verapamil or digoxin. Hypotension can also occur if taking antihypertensive medications concurrently. Also, thyroid medications may decrease the effectiveness of metoprolol, so you should always consult a physician. Some herbal interactions are sativa, ginkgo biloba, eucalyptus, CoQ10, ginseng, fish oils. Caffeine should definitely be avoided in excess amounts as it can cause tachycardia or increase in blood pressure can make the patient feel a little bit nervous or jittery. So that's why you always want to contact a physician about prescription or over-the-counter medications, vitamins, or herbal supplements. So the first discussion, a peer review article, is beta blockers in hypertension. The question is, are beta blockers okay to use as a first line of defense and the only medication to treat hypertension and other illnesses? So beta blockers are a heterogeneous class of agents. It does effects on the myocardium. It may provide beyond benefits to lowering the blood pressure, like lowering the heart rate. Traditional types like metoprolol may have less effect on reducing cardiac aortic pressure. So a lot of the times in my hospital with a patient with heart failure or hypertension or arrhythmias, the patient is not only on metoprolol, but they're on other antihypertensive agents or diuretics like Lasix, or maybe a different carvedilol or atenolol or something. There is an increased risk for new onset diabetes because, metoprolol does cause hyperglycemia or hypoglycemia. So traditional beta blockers lack the vasodilatory activity, which may be a key contributor to the outcomes that help hypertension. So in this study, the beta blockers were not given as a first line of defense. It was given including, like a Lasix or a different kind of antihypertensive medication. So the second article that I found very interesting is metoprolol-induced visual hallucinations. Studies have actually shown that metoprolol has been linked to these visual hallucinations, especially at night. So there's been a couple of case studies on this. There's an 84-year-old Caucasian woman with a history of hypertension and arthritis, a 62-year-old Caucasian male with inferior wall MI complicated by cardiac arrest, and a 60-year-old woman with a history of severe hypertension and depression. All of these patients reported seeing dead people in their room at night. And once actually taken off of metoprolol, or tapered off, the visual hallucinations stopped. According to the National Institute of Health, side effects of beta blockers on the central nervous system are relatively uncommon. This is not fully understood, and physicians should be more aware of the varying side effects of these specific beta blockers. So the healthcare provider should recognize that this is not just a dream or a nightmare. It's actually a side effect or adverse effect as visual toxicity. This is an example of my grandmother who was on metoprolol for months. She was seeing things, seeing people, seeing animals in the window, especially at night. And we thought that it was dementia, and later come to figure out that it was actually the side effects of metoprolol, because they once tapered off, they actually stopped. So that's it with my presentation. Thank you all for listening, and thank you for your time.